Hello everybody. Today we're going to be talking about my top surgery regret. Just kidding. My only regret with my top surgery was not doing more obsessive research beforehand. I'm actually very happy with my results, but if I had done the research, there are definitely things that I would have done differently, and so that's what this video is about today. I could have gotten more perfect results. All in all, I'm happy with what I've got. I'm 7 months post-op now, and I think what I have is pretty heckin' awesome. I'm pretty happy with my results, but one thing that I would have changed is the type of surgery I got. My surgeon wanted to do not just the 2 lines that most people are accustomed to seeing, but one large incision that meets in the center. And turns out that if your scar meets in the center, then there is a higher risk for worse scarring in this area. So we're going to be talking mostly about scar prevention and ways that you can try to achieve your best results. And of course, prevention is superior to treatment, especially when it comes to wound healing. You want to do it right the first time instead of messing up and then having to try treatments that don't quite work. It's better to just do it right the first time. So we're going to be talking about preventing infections, because infections can make your scarring worse. We're going to be talking about tension lines on your body, and like what kind of surgery you might want to opt for, because they're not all the same. Depending on what kind of surgery you get, you're going to have different types of scarring, different risks for keloids and things like that. The next one is, what is the next one? Moist wound healing. I wish I had read about moist wound healing, especially when it comes to, like surgeries, like big incisions. Turns out moist wound healing is one of the best ways to prevent scarring, or to at least minimize scarring. And so that's the prevention side. When it comes to the treatment side, there's a couple of things that we can talk about. And also I wanted to give you guys a little bit of a warning. We're going to be going over some of my surgery photos, which they're not really so graphic. It's just my post-op photos where I'm very bruised, and in some of the pictures you can see a mild infection. I'll try to put bookmarks in the comments or something so you can avoid those. Also, I'm not a doctor. I have no formal medical training. I'm just an obsessive person who reads medical literature for funsies because I don't trust my doctors. I have anxiety. Yeah, you're going to want to double check with a surgeon, or maybe better yet, a dermatologist. Anything that I mentioned in this video, going to want to run it by an actual doctor. So, first things first, let's look at my chest 1 week post-op. Hey, check them out. So, something really interesting is that it's like your results can kind of change in unexpected ways. So like it looks like my nipples are dead center in the areola. Like they look exactly like they're supposed to look, you know what I mean? Very, very bullseye-esque. And they didn't turn out that way after a while of healing. I'm not sure if it's very obvious. I don't think it's super obvious, but they're not quite in the center. And one thing I want you to notice in this picture as well is that the incision is very, very thin. And a lot of people get really excited whenever they first get their post-op binder taken off, their dressings removed, because they see this really thin incision. And a lot of people don't know that it is going to get much wider over time. There is no scar tissue yet. This is in the very, very early stages of wound healing, and you should expect a lot of changes to happen before you see a completed result. This is nowhere near a finished result. Also keep in mind that there can be a lot of swelling or almost no swelling after you get your surgical dressings taken off. So if you take off your, you get your dressings removed and it looks kind of puffy, sometimes that will go away. I was really lucky, and the surgeon and the nurse were both really pleasantly surprised when they removed my dressing, because they were like, wow, that's so flat. Holy heck. And something that can influence your outcome absolutely is diet. You should not be smoking. Smoking really messes up your chances of having a good, healthy recovery, and also will affect the aesthetic result of your surgery as well. Okay, this picture looks a little bit gnarly. This is the one with the infection. So this is my nipple graft 11 days post-op, and I don't know if that might be a cat hair stuck to me, but the main thing I want you to notice is this coloration here. So this is telltale sign of infection. You can also notice that there's redness, kind of inflammation. If you notice something like this, and I was a little bit sus. I was like, is this okay? Is this all right? A lot of people's grafts look like this whenever they're healing. The nail in the coffin for me was I was changing my bandages, and there was this terrible smell. There was just a nasty smell. It wasn't super strong, but it just did not smell the freshest. So if you notice a weird smell, that could be an infection, and that very much can affect the outcome of your surgery. An infection will increase the risk of you losing a nipple, so that's something that you absolutely want to avoid, and if you do notice something like this, you're going to want to treat it as soon as possible. Before we get any further into the video, before we talk about the preventing infections, working with tension and moist wound healing, the first thing I want to tell you is sunscreen. You gotta use sunscreen, or you need to be wearing a shirt at least for the first 12 months, if not the first 18 months post-op. Not protecting a scar from the sun very much results in it can increase your risk of hypertrophic scarring, of keloid scarring. It makes your scar potentially bigger and wider and more protruding. And it also, of course, affects the pigment of the scar. So if you want your scar to heal nice and skin color and invisible, you need to keep it out of the sun. If you want your scar to get super dark and stay that way and require a lot of treatments to try to fix it, then yeah, you can go outside after you got your surgery, no problem, no sunscreen needed. No, you need to protect it from the sun. That is absolutely one of the most important things. Like, that is one of the best things that you can do for your scar care, is keeping your scar out of the sun. I actually have not gone outside topless yet. I'm 7 months out, and I'm definitely really excited to start running this summer. It's March now and getting pretty warm, but I'm gonna wear sunscreen. You need to wear a good sunscreen. So let's start going through my bullet points one by one. So first one is infection. So we already saw what this looked like. This is my left nipple, and you can see that there's actually a very small sign of infection at the bottom there as well, which ended up leaving a little bit of a more raised scar in that area. And so what you need to do if you notice signs of an infection, one of the best things you can do is use triple antibiotic ointment, Neosporin. And of course, you're going to want to double check with the doctor and make sure that they're okay with you using this. But the idea is you're going to want to try to get rid of the bacteria that's causing the infection. And for me, I didn't ask my surgeon. I just started using it. I started applying it with my Aquaphor, with my dressing every morning and night. And after a few days, the smell started going away, and it didn't look greenish anymore. And so if I could go back and do it again, I probably would be mixing Neosporin with my Aquaphor dressing every day from day one, once they removed my dressings. Because again, prevention is superior to treatment. If this never got inflamed in the first place, then it probably wouldn't have ended up having this sort of raised scar that I've ended up with. Now, something that I want to make sure that you do not do is use something that could be irritating. Something we're going to be talking about later is moist wound healing. Keeping your skin moist gives it an environment where it can heal more efficiently, which can prevent inflammation and prevent scarring. And if you dry out your skin, if you do anything that causes any kind of inflammation or dries your skin out, then you're going to have worse results. Do not use alcohol prep pads. You might think, yes, alcohol, kill the infection. Yeah, it'll kill the infection, but it will also damage your skin, inflame your skin. It will do the opposite of moist wound healing. It will take your skin longer to heal. Do not use something harsh and drying. Do not use something ethanol-based, especially. No alcohol, please. Something like Neosporin is going to be a really good bet. I would definitely ask a surgeon and be like, hey, what are your recommendations for something to help prevent or treat infections topically? Here's another thing that I would probably say not to use. This is BZK wipes, benzalkonium chloride, I think is what it's called. These are the kind of wipes, an antiseptic wipe that they use like if you have to pee in a cup, because it doesn't contain alcohol, so it doesn't sting. And so you probably think, it doesn't sting, then it's probably more gentle and less drying. In some cases, yes. Sometimes it can be less irritating and less drying, but not always. So I probably would not recommend using BZK wipes. Just because it doesn't sting doesn't mean it's okay to use. Also, Neosporin is an ointment, an occlusive ointment, so it's going to help contribute to that good moist wound healing. It's definitely a good option. But of course, with anything that you put on your skin, especially something that you put on your skin during surgery recovery on these wounds, you're going to want to test them before surgery. Make sure that you don't have any kind of a reaction, allergic, dermatitis, anything. Hopefully just several weeks before you go into surgery, because you do not want to have irritated skin. You do not want to have an allergic reaction or a breakout from a product that you weren't familiar with while you're trying to recover. It's just not going to be a good time, and it's also going to negatively impact your end result. And yeah, just test everything beforehand, please. So here are some pictures I took in November whenever I started noticing that the center connecting area was getting bigger and definitely protruding a fair amount. And I used my girlfriend's iPhone to get a good picture of this to compare it to the size of my index finger. And yeah, it was very wide, and it was poking out quite a bit, and I was actually considering going to the dermatologist and getting a steroid injection. But I want to talk about why you might not want your scar to join in the center. So, back in the 1800s, this guy named Langer, was poking at cadavers, and he found that there are sort of tension lines in the skin, and if you follow these tension lines, scarring can be a lot less severe. It can help prevent keloid scars, and it can just kind of help predict a better outcome for scarring. So if you see the tension lines in the face, plastic surgeons or anybody who does any kind of cosmetic surgery or other kinds of surgeries, they will use these lines and try to follow these lines and not cross them, because crossing them increases the risk of hypertrophic scars, keloid scars, etc. Most double incision scars follow these tension lines, and so these scars are somewhat minimized. They don't have a lot of tension, and that lack of tension prevents the scars from getting super severe. But if you have a scar that meets in the middle, like I do, all of this it has a lot of tension on the incision line and on the scar as it is healing. And because of this, it's at a higher risk for all of these aesthetic outcomes that most people don't want. Most people do not want hypertrophic scars. I know that I was like a little bit shocked whenever I saw my scar expanding and protruding so much in the center. And the reason why my surgeon actually wanted to do this incision style was because he thought that I would have a better outcome. He thought that I would have a risk for pleating, you know, pleated fabric. Like imagine an anime schoolgirl skirt, you know? So he thought that if I had these smaller incisions that did not meet in the middle, there could be excess tissue, and I could have sort of like wrinkly lines from not being able to get rid of more skin, if that makes sense. Working in a 3D space with a body just seems like really wild stuff. So if I had known that this could have resulted in the protruding scar that I have, I think that I would have considered going against his recommendation, and I would have more likely considered only having these 2 scars. And of course that's going to be a personal decision. There's also, I think it's called the T anchor, where an incision can be made here and here, and these tend to be not very noticeable from what I've noticed from the pictures that I've seen. But if your surgeon is trying to persuade you into doing a surgery where there's an incision that meets in this area, you might want to discuss other options with your surgeon. So in my opinion, this picture from November 17th, I think it was, versus now, I actually think that this has improved somewhat. Whenever I used to run my finger over that part of my scar, it used to protrude a lot by a few millimeters, and now it's definitely more flat. It sticks out a fair amount still, and honestly, I'm happy enough with it that I don't think that I need or want a steroid injection to bring that down. But again, if I had known that this was a factor, then I probably would have considered a different surgery style. So if you're interested in learning more about tension in skin and how it affects wound healing and the outcome of scars, there's a really good paper called The Tension Biology of Wound Healing, and you can, I'll try to make sure that I put a link in the description. They don't just talk about the facts of tension and its effects. They also talk about some potential prevention and medical intervention to help with better outcomes of scarring. This section, Wound and Scar Stabilization Materials, to limit stretching and external mechanical stimuli during wound healing / scarring. Wounds or scars should be covered by fixable materials such as tape, bandages, garments, or silicone gel sheets. And this section here is actually why I believe Dr. Garamoni, one of the more famous top surgeons in the United States, he's located in Florida, he always affixes a tape onto the incisions of his patients, and it's a tape that you cannot peel off. I mean, you probably could, but it'd probably hurt. But that tape very likely is one of the reasons why his patients have such thin scars. This strip of tape, it seems to stay on, I think, for at least 3 weeks. If you went to Dr. Garamoni, let me know. And I believe because of this tension, that is the reason why a lot of doctors want you to keep your elbow below your shoulders for 6 months. I didn't do that because I couldn't live my life like that. I couldn't not put my dishes away onto the highest shelf for 6 months straight. So I just didn't follow that rule. Plus, I looked at a lot of different photos. I know this is unscientific. I looked at a lot of different pictures, though, of people who went to surgeons who instructed them to keep their elbow below their shoulders, and then people who went to surgeons who did not give that recommendation. And the outcomes were not different from what I could see. Again, you're probably going to want to follow your surgeon's rules, but I also didn't want to have my muscles degenerate so much by not moving. It's very uncomfortable to be so stiff. I want to move my arms around. I'm not gonna listen to that. So yeah, again, options for this, for scar stabilization materials would be tape, bandages, garments, or silicone gel sheets. So silicone gel sheets, I think this actually works in 2 different ways. I ordered this one from Amazon because it was the cheapest Cica tape, and I actually did not use it for that long because, I don't know, it's just kind of irritating and it wasn't what I wanted to do. And I had seen a study that said that tretinoin is sometimes more effective for treating and preventing scars than silicone. So I decided to stop using the silicone and started using tretinoin. So anyway, you can get one of these. Definitely recommend cutting it in half. And you can actually keep reapplying this. You can, after it starts losing its stick, you can just run it underwater, let it air dry, and a lot of the time that is enough for it to get its stick back. And it's fine to do that because it's not applying a medication. You're not washing a medication off. The medication doesn't wear off. It's just a physical thing. You're just holding the wound together. And like I was trying to say earlier, I think this actually works in 2 ways. This doesn't just help with the prevention of tension, but it also helps, I think, with moist wound healing. Whenever your incision is underneath this, it's in a moist environment. It's trapped underneath a very thick occlusive material, and so let's just get into moist wound healing. Alright, so I'm lazy as hell, and I don't really feel like looking up a study for this, so if you want, you can just believe me. Really not happy with how my past self made this section, so hey, it's editing me from the future, and we're gonna redo this part. Okay, so here is a paper that I would recommend that I'm gonna put in the description. You can check it out. And the core takeaways that I want you to look at: wet or moist treatment of wounds has been shown to promote re-epithelialization and result in reduced scar formation as compared to the treatment in a dry environment. And there's a core takeaway table that I want to show y'all. Okay, take-home messages. Wet or moist wound treatment significantly reduces the time required for re-epithelialization and leads to reduced inflammation, necrosis, and subsequent scar formation, as has been demonstrated in several large animal studies, as well as limited clinical studies. Re-epithelialization is basically skin repair or regeneration. Wet or moist treatments have no adverse effects on the wound itself or the surrounding tissue. So that's kind of just addressing this myth. You know, a lot of people, when you're a little kid, your parent puts a band-aid on your owie, your boo-boo, and after a while they tell you to take off the band-aid because they're like, oh, it needs to air out, you need to let it get some air. Nope, it's not a thing. There's no adverse effect. There's no reason not to just keep it closed off for an extended period of time. Of course, you do need to actually be changing your band-aids just for hygiene purposes. A wet environment can allow for precise delivery of antimicrobial agents and analgesics to the healing wound. So if you need to apply any kind of a medication, then a wet environment can help with that. For example, Neosporin, actually its carrier, I believe, is Vaseline. It's petroleum jelly. So it's like there's 3 different antibiotics inside of a moist wound healing product. Another part that I want to show y'all is in here. It kind of gives you the TLDR of moist wound healing and scar reduction. So healing of adult human skin wounds is associated with varying degrees of scar formation. Scarring can be correlated with the intensity and duration of inflammation during healing. So that inflammation part, again, you want to prevent infection. And I believe I've also read a study, or have read somewhere, that moist wound healing can help prevent infection as well. Not sure. I'm not going to look it up, though, because, again, it's true. I am lazy. Inflammation was greatly reduced in the wounds treated in the wound chamber, and there was a very strong correlation between the number of inflammatory cells on day 3 and the amount of scarring that had developed by day 28. Wet wounds created under sterile conditions, here treated with low concentrations of antibiotics, exhibited a significantly smaller macroscopic scar surface area in all experimental wound groups compared with dry wounds. And yeah, more inflammation predicts more scarring. Moist wound healing is the heckin' way to go, my friends. And to give a couple examples of moist wound healing, my surgeon's method for healing the grafts was absolutely a moist wound healing method, and I'll go ahead and show a video of what that looks like. It was applying Aquaphor over the nipple graft, which is an occlusive, it's very similar to Vaseline, and then a dressing called Adaptec got put on top of that, a non-stick dressing, and then another thicker padding of a non-stick dressing got put on top of that with a gentle medical tape. If you've looked at a lot of top surgery healing photos, healing in progress photos online, you've probably noticed that some people's nipple grafts become scabs. The entire nipple and areola is one big scab, and that's what you end up with if your surgeon does not have you do moist wound healing. Moist wound healing generally will prevent scabbing. Whenever I get acne on my face, like I do now a little bit, especially if I squeeze something, if some skin comes off, then I always use a hydrocolloid bandage. It's also known as, what is it called? Duoderm is a brand name. Those little tiny pimple patches, you know? So it's lightly adhesive, and my boys are having a fight. I'm sorry, this is very distracting. Can y'all stop this, please? I have to do something about this. If I could go back and go to day one with my surgery again, I would be focusing on providing a moist environment for my incision scar, for my incision wound, because my surgeon actually didn't have any kind of instructions. He didn't have any dressings. It was just, don't touch it, was his instructions, which, to be fair, is pretty good instructions for most people, because most people don't look at every single ingredient. They don't go on cosmetic DNA websites to check out whether or not ingredients are safe, and they don't do patch testing. If you are confident in your abilities to find products that are safe for you, then I would highly recommend experimenting with moist wound healing. So since we're talking about moist wound healing, I'm going to go ahead and give you the 101 on keeping your skin moist as heck. So it's going to be a 3-step process. The first one is cleansing. There's something called transepidermal water loss, which is the tendency for your skin to lose moisture, to lose water. And your skin is extremely prone to that after cleansing, after getting wet. So what you want to do anytime you wash your skin, whether that be your face or your incision scar, is while it is still damp, don't rub a towel on it, don't pat it dry while you're still wet. You want to use your gentle moisturizer. I would recommend something like CeraVe in the tub. It's extremely bland, but some people do have negative reactions to it. It's a very small amount of people, but there still are some people who do. So again, no matter how bland and gentle and fragrance-free a product is, please test before surgery and make sure you react well to the product. Another product that I'm really excited about, so this is a step 2, applying a moisturizer while your skin is still wet to prevent the transepidermal water loss, and to retain as much moisture as possible in the skin. And another moisturizer that I highly recommend is Eucerin, what is it called? Eucerin Advanced Repair Cream, I think it's called. It has 5% urea, which is where all the magic happens, and I'm never going back to CeraVe in the tub. Like, I have, I think, 2 tubs at my house that I still need to get through, And I'm gonna try to get through them, but I'm not gonna buy it anymore, because, wow, Eucerin is some really good shit. And the third step is applying an occlusive. An occlusive is something that nothing can really escape. Products and water are not really going to be able to escape or enter an occlusive environment. So whenever I'm talking about that, I'm talking about stuff like Aquaphor. I'm talking about Vaseline. And Vaseline is basically a cheaper version of Aquaphor. Its texture might be slightly different. You really don't have to use Aquaphor. If you like Vaseline, you can use Vaseline. I like using Aquaphor because it comes in a tube, which is like a little bit more hygienic in my opinion. So yeah, if I could go back and treat my wound again from day 1, or actually technically I didn't get my surgical dressings off until I think day 6 days after I had surgery. So from day 6 I would have been applying a moisturizer and an occlusive, especially after showering. But you're gonna want to ask a doctor, not me. I'm not a doctor. By the way, this is the website that I mentioned just a second ago. It's COSDNA, COSDNA. Websites like these can provide a really solid insight, and it's also a really good way of figuring out, like, if you reacted to a certain product, figuring out, like, which ingredient it was specifically so you can avoid that in the future. That should conclude our section on moist wound healing. 2 days younger version of me. Back to you. Okay, so we've already talked about prevention. We talked about sunscreen, very important. We talked about preventing infection, tension, and moist wound healing. And the last section is one that I actually don't know a whole lot about. I haven't done a whole lot of research in this section because to me it hasn't been super relevant, because I don't think I'm going to need a lot of scar treatment. I'm fairly happy with how my scar is turning out so far. But if you have developed a more severe, in a aesthetically unappealing scar, if you're not happy with your scar, you might want to look into certain treatments. The first one is if you have a keloid scar, or if you have a very raised scar, if it's very three-dimensional. Hypertrophic. If it is ropey, if it is hypertrophic, then one of the first things that you might want to consider, depending on how long it's been, you might want to wait at least 6 to 12 months before you go down this route. But talking to a dermatologist about steroid injections can be a really good idea. It can be really helpful for a lot of people. And one risk, though, with getting these steroid injections is basically what they do is they will decrease the inflammation. They'll decrease the projection, so it won't be coming out from your skin very far. But there is a risk that it can cause a dent where there's sort of like a dimple because it's a little bit concave. That's something that could happen. Also, they're apparently very, very painful to actually get the injection, so you want to find a nice dermatologist who will use some kind of a topical anesthetic. The other thing is, even though it will make your scar less projecting, it can make your scar more wide. So these are definitely risks and potential things that could happen if you go this route. So I would absolutely sit down and talk with your dermatologist and see if that's something you might want to do or not. One thing that's really important to remember with all this scar care stuff too is that a lot of the time it's not in your control, it's not your fault. A lot of it can be up to genetics and other health conditions. So for example, certain ethnicities are more prone to hypertrophic and keloid scarring than other ethnicities, and so that really sucks. And there are a lot of chronic health conditions that people have that can result in worse aesthetic outcomes than others. Basically, all I'm saying is bodies are weird, so do not be mean to yourself. There are ways to try to influence the outcomes of scars, but they're not 100%, and a lot of the time, even if your surgeon does everything right, even if you do everything right, you can still get crazy huge scars just for no reason or for a mystery reason. So just be nice to yourself, be nice to other people. You see people who have really big scars, it's no big deal. It's just bodies are weird. So besides steroid injections, I wanted to talk about a treatment that I have been using for my scar, which is a topical prescription called tretinoin. And I did see a study one time that demonstrated that silicone scar sheets are a little bit less effective than using tretinoin. And tretinoin is something that can be extremely irritating, extremely drying. So this is something that you're not going to want to use until the wound is completely healed, like at least probably 3 months out. I was actually prescribed it for acne, and I definitely plan on making a video about acne sometime in the near future because, yeah, trans masculine people, testosterone is a real bitch when it comes to acne. Okay, so I know this video was really long, so I want to give you the rundown. Before you go, I'll give you the Spark Notes version. So, prevention is key when it comes to having good outcomes for wound healing and for scars. Faster, more efficient, and less problematic wound healing tends to result in more aesthetically pleasing scar outcomes. So that means you want to prevent infection, inflammation, dryness, and you ideally want to have scars that are in a low tension area. You can help prevent infection by using something like a topical antibiotic ointment. You don't want to use something drying or irritating like alcohol. Neosporin can be a very good option for this though. Also, don't be me. Don't try to DIY this shit. If you notice signs of an infection on your graft or on your incision, you are going to want to get in contact with your dermatologist immediately. Don't just go, I guess I'm gonna put some Neosporin on it. Like, that shit was a little bit silly, and you should be in touch with your doctor. You definitely should be in touch with your doctor. And again, make sure that you have tested all of these products on another area of your body, a non-broken skin area, ideally several days before you even get surgery, to make sure that you aren't going to react to anything that you're putting on your skin. So prevent infection. Of course, sunscreen. Keep it out of the fucking sun. For the love of God, just do it. Just please wear your sunscreen. Next preventative measure is tension. So you might want to choose choose a surgery where your incision lines are along an area where you're not crossing any of these tension lines. Yeah, pretty easy, and most people want this kind of incision anyway. Just kind of depends on what you and your surgeon think is gonna be best for you, you know? Next one is moist wound healing. If it's a product you trust, very bland, no fragrance, it might be a good idea to use that on your incision. And when it comes to treatment, there are a few options. You might want to try the silicone strips. I actually kind of consider this in both categories. It provides a moist wound healing environment. It also helps relieve tension on the scars. So I consider it in both categories of prevention and treatment, because even if you've had the scar for a while, a lot of the time you can use silicone scar strips and have pretty good outcomes with this stuff. Another one is tretinoin. Tretinoin is magic. I love you, tretinoin. I love you so much. But yeah, this turning over of the skin cells, and I think it also improves collagen production. It can potentially be very good for improving the appearance of scars, old scars or relatively new scars. And of course, I'll keep you updated with how my scar is going to look in about 6 months from now. Yeah, I will definitely make a 1-year post-op video. I have a feeling that my scar will be much less pink by the end of the first year. And then, of course, if you have a scar that's projecting, something more severe like a keloid or hypertrophic scar, that's something that you're going to want to go to a dermatologist for and potentially get a steroid injection, which can be extremely painful from what I hear. So try to find a nice doctor who will use some kind of topical numbing solution. Yeah. Okay, so that's basically everything for today. I hope y'all have a good day. Happy healing. Let me know if you've used any of this stuff, and even like some of the bad stuff. Did you use vitamin E oil, and did you cause some kind of a reaction, or did it actually end up being good for you? I want to know. I'm curious. So I will see y'all next time. Have a lovely day. Bye.